this is Erin with Best Life Physical Therapy, and today we're going to talk about a technique to do when you have pain with bending your knee. And this bending can be painful when we go into a weight-bearing position. So if that's the case and you're having pain with bending, then let's try this technique. So what we're going to do is we're going to take our hands in kind of like a wing nut fashion, and we're going to place them on the tibia. And what we're going to do is we're going to take our hands internally rotation and twist external rotation like this. And then we're going to try the motion again. And if that motion is pain-free, then that's the technique that you're going to do. So you saw me just take my hands away, and that's actually not what I want you to do. I want you to keep your hands in this wing nut fashion, twist the tibia outward, lean in, and if that's completely pain-free now, then we're going to do some repetitions. We'll do 10 repetitions, leaning in like that, just actively. We're not forcing anything. Every single repetition should be completely pain-free. And then as we do it, we may need to kind of readjust our hands a little bit and make sure that we didn't lose the grip. And having a skin-to-skin contact may be even better than clothing. And then after you get to 10 repetitions, then we're going to just take a little break. And we'll take another break. We'll take a break, and we're going to do a second set of 10. This second set of 10, we're going to twist the knee, the tibia, I should say. We're going to lean in, and we're going to hold 1, 2, 3, and come back out of it. Twist it again, and hold 1, 2, 3. Just in that fashion, and you'll do 10 repetitions that way, 1, 2, 3. And you'll notice that I'm not going far, I'm not leaning in a lot. We go to the end range, we hold it for 3 seconds, and we do our second set with a 3-second hold at the end. On our third set, what we're going to do is we're going to try to give some overpressure. So what this joint really wants is to know that it can go all the way in without pain. And it may be able to go to this spot at this point without pain, but going past that might still be painful, and that's okay. What we're going to do is just reposition that little joint. This is what we call a positional fault, so we're just correcting that positional fault, and we're going to twist that knee, or the tibia here, bring it in, and then while we're here, we maybe need to take those thumbs out because they may be painful. We're going to lean in and hold that for 1, 2, and 3, and then come back out. So that's called overpressure. So twist, lean in, hold 1, 2, 3, come back out of it, reposition, make sure you haven't lost your grip, 1, 2, 3. That third set is done with overpressure. There you go. So after you've done 10 of those with overpressure, then what you'll do is you'll just go in and out in an active range of motion fashion. It should be completely pain-free. And if it's not, then we didn't do something right about that technique, and it's not going to be fruitful for you. But if it is, then you may just need to use this technique over the next couple of days, a couple of times, just to kind of remind this knee the positional fault needs to be corrected. Now, one other thing that you can do if you have this problem and this technique helps it is we can place some tape on the knee. And so what that tape would look like, we may, there's a special kind of tape that we use. It's called, the name for it is McConnell tape, but it's actually, it's not even, I ended up using the McConnell tape in my clinic, but you could use kinesio tape for this as well. So you're going to place it here, and you're going to wrap it around and come around the back. So it's a diagonal pattern, not going on the knee. You're going to go on the tibia because you're trying to twist it outside, and then you're going to come up the back of the hamstring back here. So we'll post a picture and a taping technique for that taping as well.